coming. I know it's a drive for some of you to get here, but we do appreciate it. I'm going to talk to you tonight about some sinus issues and all the different options you have for sinus disease, because it's not all, of course, one problem. I gave this talk about 6 months ago, and it's somewhat similar. We did tweak it some. Things can change in 6 months. For example, before I had a picture of my little boy up here, and now I have a little girl. So things change in 6 months. So our little girl's now 2 months old, and a pretty happy baby, so we're pretty lucky. But so it's kind of funny that I was looking at my old slide deck, and I had my little boy up here, and I'm like, oh, I have another child now. So let's get started. So the three main questions we want to talk to you about tonight. 1, what are your sinuses? It's pretty simple. 2, what is sinusitis? So what are we talking about exactly? And then 3, how do we treat it? And if you have sinus problems, you probably feel like this guy some days where you feel like your whole face is your nose. So it's an interesting problem to have, and if you do have sinus problems, you're pretty miserable. So it's something that you can all probably relate to at some point. Where are the sinuses? Well, these are air-filled cavities in your face. Everyone has 4 sets to start with. Okay? So the first set is the frontal sinuses, which are in the forehead bone. There's a little arrow here. So it's up right above your eyeballs. All right? The second are your maxillary sinuses. These are in your cheeks, just below your eyes. Right there. The next set are your ethmoid sinuses. Now, these are between your eyes. Instead of being one big cave, they're a bunch of little caves, kind of all lumped together. But they're kind of right there in between, if you ever have pain in that area. And then lastly, are the sphenoid sinuses. Now, it's not in this picture, but they're behind your eyes, kind of behind the ethmoid sinuses. If you were to look at the sinuses from a side view, it'd be right in the back up here. So they're the farthest back, and right above them, of course, is your pituitary gland and the brain and things like that. But it's way in the back, just above your adenoids. So that's where all your sinuses are. There's a right and left side, which gives you 8 total sinuses. Try this again. And in general, what are they? They're essentially air-filled cavities in your face. They're lined by a very thin layer called a mucous membrane. It's a little layer of kind of skin, if you will. In terms of what they do, no one could really tell you. They don't really have much of a function other than, lightening the load of your head in a sense. They have, even though they're big caves, they have these small little holes which go into your nose. They usually enter in a little recess or something like that. And then these recesses are actually kind of hidden by projection of bone and tissue over them. So the point being, it's not like you have a big cave in your sinuses and a little hole just to drain them all. It's actually a pretty complicated pathway to get from your sinus to your nose, hence all the problems you can have. Okay? Otherwise, it'd be a quick, simple thing to fix and see. So sinusitis, basically it's inflammation in general of the sinuses. So on the left side of the screen, if you're looking at it, you have a normal appearing sinus. On the right side, you have inflammation. Whether there's pus there, polyps, or just a thickened lining, irritated skin, all that can give you pain and symptoms. In general, sinusitis is just an inflammatory response in your sinuses, and that's pretty nonspecific, right? So this can be from allergies, it can be from a virus, bacteria, or from a fungal infection. You see kind of a little bit of everything. Usually you see this when you have what we call URI symptoms or viral symptoms. And it's usually lasting longer than 10 days and will not usually improve on its own. It affects a lot of people. So here, about the last time they did this survey, which now this is a couple years old, but about 14% of the U.S. population is affected by sinusitis. It's directly responsible for about $8 billion a year in healthcare. It's a top 10 diagnosis in terms of lost productivity with workers. And you can see on the graph, they go in, these are all millions of days, lost work, restricted activity, just being in bed or being sick, and then healthcare visits. But it's a lot of office visits every year to your family doctor, internal medicine doctor, or whoever does your primary care. A lot of visits for this. So it does affect a lot of people and kind of often. Well, how does it develop? Well, I try to simplify this to really kind of make it easy to follow because it's really 3 key steps kind of gives you a problem. So rhinitis is just the general inflammation of your sinuses. And again, it could be from the allergies or fungus or bacteria or other. It could be from pressure changes. If you dive a lot, going up in a plane, that can cause it. Just like you can get ear problems, you can get sinus problems. It can be from dental problems. So the teeth are actually, the roots of the teeth are in the cheek sinuses. So dental extractions, dental infections, these can all go to your sinuses and cause a problem. And the 3 steps I was telling about, the first is always inflammation. So something is causing inflammation. Now, once we get inflammation, the general response is swelling of the sinuses, or the lining. Just like if you get an infection on your skin, it swells. Same thing happens in your sinuses. Okay? When you get inflammation, swelling, pus, and this kind of builds up, well, that now causes obstruction. Obstruction means things that would normally exit your sinus are now being blocked. Okay? And when we get obstruction, we get increased pressure buildup, we get blocked sinuses, we get the pain with symptoms, all the above makes you miserable. Okay? So the three key things are inflammation, obstruction, then the pressure buildup, and the symptoms are usually from one of those 3 steps. Here's a little kind of picture example. On the left side of the screen, you'll see what we would consider a normal sinus flow. So the nose is always making mucus, about 1.5 liters a day. You don't really notice it. Obviously, that'd be kind of gross. But it's slowly made. It slowly gets moved around. The sinuses are designed to clean themselves. There's these little hair cells that kind of move it all in one direction, out the natural hole of your sinus, into your nose, down the back of your nose, into your throat. Then either you spit it out or you swallow it. It's the normal flow. Everybody has it, whether you like it or not. So I know it's not fun to talk about. And instantly, you can see how the tooth roots are really close to the sinuses here in this picture. Well, on the right side of this, on the right side of the screen, you can see the exact opposite problem. So now the lining, which is thin on the left side, is thickened. The little green arrow is showing you the flow of mucus is now blocked, and you're getting buildup of debris and pus, serous fluid, that kind of stuff. And this shows you a pretty clear example of a healthy sinus versus not healthy sinus. There's different kinds of sinusitis, so we try to quantify. Do you have an acute sinusitis, which is a short-term infection? Acute in medical terms means short-term no matter what you're dealing with, so no different here. So symptoms lasting longer than 10 days, it's more of a, you're past the whole, maybe it's a virus thing, but it's less than a month, and that's the acute kind of flare-up. Then you can have a subacute, which is a little bit longer, anywhere up to 3 months' time, but not any longer. And then chronic, which is symptoms longer than 3 months. And what you'll find is there's a difference between the acute flare-up and the chronic persistent problem. The acute flare-ups are always worse. Chronic is more that underlying kind of slowly brewing, discomfort, drainage, etc. So you have different severity of your symptoms based on the time frame too. But these are in general the 3 basic. Then there's also what we call recurrent sinusitis, where really you're getting frequent flare-ups. 3 or more infections a year is kind of abnormal. If you just get 1 a year, okay. But 3 or more infections a year, and you get resolution of the symptoms between episodes, whether it's from antibiotics or whatever treatment you've been given, is a different category. A lot of these recurrent sinus sufferers are actually chronic sinus sufferers, and you get antibiotics, your symptoms get better, and you think you're doing pretty well, but really you still have the same underlying problem, and you're just waiting for that next little thing to kickstart it up, and then you have another problem. So these are kind of in the same group, but some people think, well, I don't necessarily have the symptoms for 3 months, I just get recurrent infections. It's a variation of the same thing, and you probably do have an underlying infection the whole time. It's just flaring up again. So some of the symptoms you could have, there's a whole list. I mean, it varies depending on which sinus is infected, how long it's been infected, what it's infected with. But, URI symptoms, allergic rhinitis, the runny nose, you get history of pressure changes, dental extractions, of course. You're tired. Pain in the sinuses is a very big one, in your cheeks, between your eyes, above your eyes. The sphenoid sinuses, which are the ones that were kind of way in the back, they have a very atypical referral pattern, so you can get pain on the top of your head, the back of your neck, the sides of your head. It's not as specific as your cheeks hurt. Postnasal drip, low-grade temperature, obstruction, headache, all the above can be symptoms of sinus problems. Cough is a big one too. A lot of postnasal drip comes from this. In terms of what we look for to diagnose it, of course, pain of the sinuses, swelling around the sinuses, We're looking in your nose, we're looking for swollen or reddened mucosa. The lining just looks irritated. Of course, if you see purulence or pus coming out is another big one. And then you look for drainage going down the back of the throat, coming out the front of the nose. Is the nose obstructed? That could be sinus or other problems causing that. But these are the general kind of symptoms we look for as physicians. And then you might ask, well, what's the point of going through all this? I get an antibiotic, I feel better. Well, there are some pretty bad complications of sinus disease that kind of gets left untreated. Now, of course, these are worst-case scenarios, not to scare anybody. But, your sinuses are next to your eyes, so you can get abscesses, infection in the eye itself, around the eye. They're next to the brain. They can go into the brain. You get subdural, dural abscesses. You can get meningitis. Kids, especially with asthma, it can be a frequent source of wheezing, so they're always draining. That's kicking up the reactive airway. And then cavernous sinus thrombosis is a fancy term which basically means a blood clot in the big veins of the brain. And it's about 50% fatal. Of course, it's not common, but it's one of those things that we worry about with people that get really, really sick and get admitted to the hospital. So now we've kind of talked about what it is, we'll kind of start going into the treatment. So there's a lot of over-the-counter stuff out there. You go to any pharmacy and there's probably a whole aisle, or at least half an aisle, dedicated to the symptoms you have from sinus disease. Now, a lot of these are pain relief, so acetaminophen, which is Tylenol, Motrin or ibuprofen, Aleve, all the same kind of pain relievers. That's just, of course, treating the pressure pain. Decongestants are like your Sudafed or pseudoephedrine, and they're meant to decrease that congestion of the nasal lining, make you breathe a little better in hopes that you might drain. Nasal saline irrigations are like what this lady's doing in the picture, having a good time. I don't know if it's that fun, but it's basically salt water rinses in your nose. Kind of think of it like brushing your teeth. So you're rinsing the stuff out of your nose. The interesting thing with this, though, is you really don't get a bunch of the saline into your sinuses doing this. It does rinse out your nose itself. It's very good for rinsing the pollens out. You do get a little bit deposited in the sinuses, but I think studies have shown it's around 1.5%, so it's very low. But the whole point of this is really not wash out your nose. It kind of lets the saline sit in there and thin the mucus so you can clear it better. Is really the long-term kind of help with this. Antihistamines, if you have allergy symptoms, can really help you with this too. Of course, increasing your fluids, getting rest, are good advice. Humidifiers or taking a nice hot shower. I'm sure a number of you have done that before, just to kind of help you loosen it up. So if this doesn't work, now you're going to the doctor. And what prescription options are generally given are antibiotics, of course. There's all different kinds. There's guidelines for what to use and when. Nasal steroid sprays. This is like Flonase, Nasonex, Nasacort, Viramist, Rhinocort. There's 10 or so on the market. Nasal antihistamines is like a topical Benadryl spray. It's like Astepro, Astelin. These all work locally. Then you can do oral steroids too, which is like dropping the hammer on it. It's really decreasing inflammation, but there's side effects, of course, and you can't be on them long term, just like the antibiotics. The other two options, the nasal steroids and the nasal antihistamines, you can be on those long term with really not too many side effects. There's little irritations you can have, but those are in general your prescription options. Now, if this doesn't work, what do you do? So we start looking, do you have allergies? Around here especially, right? All the pollen's all over our cars these days. Allergies are a big thing. Now, have you tried allergy medication? Have you not? Do we need to test you to see if you're allergic to something? How bad is it? All that can be done easily in the office. If you do have allergies and you feel like the pills and sprays aren't working, you can have what's called immunotherapy, which is allergy shots, giving you what you're allergic to in small doses. The other option could be a drop under your tongue, so you're not getting it at the doctor's office, you're doing it at home. So there's different options you can do for that. And that's something you can decide upon, as you progress down this road. But barring the allergies part, if the medications aren't working, you have two options. One is live with it. So you've been doing this and you can just keep doing it. That's valid for some people. They just don't want to do anything. Or you start talking about surgery. What can we do to help you out? So that's where we're going to go next. In general, I want to kind of give you a good description of why technology has changed and why we're always trying to make it better. So if we have 37 million people who suffer from sinusitis, well, about 7 million of those will be what we would call chronic sinus sufferers. Okay? Now, of those, medications are pretty effective. They work 80% of the time, so not everybody that has chronic sinus problems actually needs a surgery, but you do need to play around with medications and get something that would control it. So for 80% of the people, that works pretty well. Well, that leaves 20%. And the 20%, which is around 1.4 million people a year that at least could be getting a surgical consult for, this is not helping, I'm still sick, I still feel awful, I get recurrent infections. Well, what happens to them? Studies have shown around over half, 900,000, just decline surgery or decline a referral for surgery. This could, a whole range of reasons. Either they don't feel like they want to go through a surgery, they think it's awful, something they've heard. They're ineligible to have general anesthesia or to have a surgery, or they just don't feel like it. There's all kinds of reasons. But so what happens to these 900,000 people is they just kind of keep going through the cycle. So you're really not helping people. You're knocking down the infection in that chronic sinus thing. You're giving antibiotics, it knocks it down. Of course, you feel better, then it comes right back, and you give antibiotics again. And you can see the cycle, how people just get stuck in this rut. So the goals of surgery, when I talk to every patient in the office, I tell you the same thing. The goals of surgery are just to open your sinuses. We want to make that natural hole that I showed you on those pictures that was really small, we want to make it bigger. Okay, we make it function better. And this allows drainage and reversal of the disease. We want your sinuses to work themselves and to clean themselves out. That's what they were designed to do. Okay? We want to preserve as much of the normal anatomy as possible, so we don't want to go and just start taking a bunch of stuff out, because what you take out you can't put back. This gives you faster healing. It gives you better outcomes, frankly, and it reduces the overall inflammatory response. You can get inflammation from having surgery as well, of course. In a sense, less is more with sinus surgery. You want to make sure that you're treating somebody, but you're not doing damage either. So it's not like you want to just kind of, like I said, what you used to do is just take out a bunch of stuff and think, oh, we made it better, we opened a lot of things. Well, you want to do it functionally. You want to make what's naturally there better and let the sinuses work for themselves. And this is all, of course, new concepts as sinus surgery is fully understood and more studies are done and things like that. So we've come a long way. Back in 1800s or whatever, they did what's called a Caldwell Luck, which is basically sinus surgery through the mouth, under the lip, etc. Of course, it was not the best surgery. It required a lot of scraping, removal of stuff. There was risk of nerve damage. You get numbness to your teeth and to your cheek and things like that. This was largely replaced, we really don't do this anymore, by what's called FES, or Functional Endoscopic Sinus Surgery, which has really kind of changed the game in the 1980s, and it's still changed a bit over the last 2 decades. But really what it was is, instead of going through the mouth, we're now going through the nose. Okay, that makes sense. And through the nose using endoscopes, which are little cameras. It shows a nice magnified view. You can actually see what you're doing through the nose, where with just a light, you couldn't see before. You really need that kind of detail and the magnification. This led to a reduction in trauma, better outcomes. This is when it first came out. They were doing it where the doctor was leaning over the patient, looking through this eyepiece. This is all actually projected on a monitor now, so we're not breathing on you or anything. But it's much easier, much more ergonomical. But then lately, in the past 6-7 years, there's something called Balloon Sinuplasty, which is kind of the end of this, where now you have full preservation of tissue. We're not cutting stuff. It's proven safe, and it works well. Now, that's ongoing research. Like I said, it's relatively new. It's not an option for everybody, which is kind of part of the workup of who needs what, and we'll go into the details of that in a second. So, since I'm not really going to talk about the Caldwell Luck through the lip thing, because, like I said, we don't do it anymore, so there's no point to talk about it anymore. The functional endoscopic sinus surgery is probably what you've heard of, the Roto-Rooter or something like that. It's completely done through the nostrils. There's no incisions, outside on your face. We are using these little telescopes. There's different angles, so you can literally see around corners. And it makes it easier. There's small instruments designed for sinuses to remove tissue without using big instruments, which are less, of course, accurate. And really with this, you're initially it was not functional, then it became more functional, where we started learning, hey, you actually need to open up the natural hole, not poke extra holes in the sinuses. You want to go for what God gave you and make it better, make it work a little bit better at least. And really, you're removing things that block the sinuses, whether it's tissue, polyps, etc. This can all be done through an endoscopic sinus surgery and done pretty successfully. There's other procedures you can do in conjunction, of course, with sinus surgery. Septoplasty, which is straightening the inside of your nose. Have you ever heard of a deviated septum? It's where the cartilage in the middle of your nose is crooked to one side or the other, and it kind of plugs up your nose on a permanent basis. And there's not a spray or a pill in the world that will fix that. It's an anatomical deformity. You need a surgical correction of that kind of thing. And the turbinates are those little things in your nose where if you have a cold or allergies and all of a sudden you can't breathe, you're doing the whole mouth breathing Darth Vader thing, well, that's because of those. They swell. They're meant to swell. They humidify the air, they heat the air as you breathe it in through your nose, and it goes to your lungs. Well, they're very reactive, so they're the things that swell up. If you get around something that bothers you too much, it can plug up your nose. For this, if you need any kind of stitching, it's usually dissolvable, so you don't have to pull anything out. They're internal, you don't see them. These are usually about an hour cases, depending on exactly what you're doing. They're outpatient. Now, this is starting to get more specific to me because I can't speak for everybody, but we do not use 6 feet of packing. We use dissolvable foam. It turns into water. You don't feel it. You really don't even know it's there, other than sometimes people say, hey, I blew something out of my nose. It looked kind of weird. That was some foam. But other than that, there's no pain from it. These are meant to minimize scarring, help it heal quicker and better without things healing together. But like I said, it's painless. Here's just a quick picture of, it's blown up of course, of a microdebrider, which is an instrument that kind of sucks tissue in, and it's an oscillating blade that cuts. So it's very good for like taking out polyps and things without truly cutting out big chunks of tissue. Is very precise for removing polyps and things like that. There is surgeon-to-surgeon variation on technique with this. Everyone was trained a little different. The revision rate's about 5 to 10%, which is pretty good from considering other surgeries are about the same. It's pretty researched. Like I said, it came out in the 80s. So when new technology comes out, this is what we would call the gold standard, which in medical term means this has been the standard of care. So we need to compare new stuff to the standard of care to see if it's better or worse. And this can be used with image guidance for hard cases, revision cases, or polyp cases where you really need to have a roadmap of where you're going. Image guidance is basically like a live action CAT scan, so you can kind of see in real time where you're at in the nose. Well, this brings us to the next part, which is balloon sinuplasty. So this is similar to technology used in other specialties. It's really not a new overall technology, just a new application. It's you've heard of it, balloon angioplasty. I'm sure everyone's heard of that, with opening up the blood vessels in the heart. It's proven effective and safe, minimal trauma. So what are the benefits of this technique? It's the most minimally invasive. So if we're really trying to preserve tissue, there's literally no cutting with this. It opens the drainage pathway and then leaves it open. It's also, of course, the maximum tissue preservation. So again, we're not cutting anything, which is always a plus. And if you really had to have a bigger, longer, surgery down the road, you're not really hurting anything. We're not removing something that we can't put back. Part of the problem I see in some patients that had surgery in the 80s are a lot of stuff was removed, almost too much, and then you can't fix that. I mean, it's gone. So this, really does not prevent you from having anything further. It's a great procedure to have to give you the benefit without all the pain. Here's a picture of it. And even though we call it a balloon, I want to make sure I don't give a misperception. It's not like a soft balloon like you get at Publix or something. It turns very, very hard, and it only gets to a certain shape, just becomes harder. So it's not like if we keep the pressure going up, it gets bigger and bigger. It's meant to go to a certain diameter and stay that way, but the actual pressure is up to 12 atmospheres, which is much higher than your car tire. I mean, it's really, really stiff, and if you push on it, it does not give. So it gives a very good dilation to a set amount, so it's very, very safe. You can't, in a sense, overinflate it. There's really no damage you can do. You'll just pop the balloon and it won't get any bigger. With this, there's, of course, a great safety record because, like I said, it's minimally invasive. There's over 75,000 maxillaries treated, and again, this is old numbers. It's catching on all over the country, but a lot of science is done with this technique. It's not something where, we've done 10 and we think it's cool. And in terms of patency, meaning it's staying open, over 90%, 94%, which is very, very good, compares better, if not more favorable to the traditional remove stuff, and hopefully it doesn't scar technique. In terms of revision rates, very, very low, around 1%, just slightly over. But again, very, very good data we have in terms of it's safe, it's effective, and it stays that way. And the whole point is really we're doing the same job, but we're making you feel better with less pain and less downtime. And that's kind of the main benefit to this is less trauma to your nose, less pain for you, and get back to whatever you want to do quicker. So I'm going to show. If a picture's worth 1,000 words, hopefully an animation's worth like 1,000,000 words or something. I'm going to show you a animation. I'll explain it as we go. This will be looking at your sinuses from the front, and you're going to see on the left side of the patient's face, right side of your screen, is a blocked sinus like we showed in the other pictures. The balloon goes in through your nose. There's a little guide you can see that kind of points you in the right direction. A little guide wire, which is lit, gets put into the sinus. And in this picture, you can see it lighting up on the cheek, so this confirms placement. And you can actually see it floating around in there on the other side like a flashlight. Now, once you're in the sinus, a balloon goes over this. Now, the balloon gets put in the right position. There's little markers to guide us, and we inflate the balloon. Now you ask, well, why does it close? Does it not close? Because we're microfracturing paper-thin bone that you would never notice otherwise, and it sets that way. So there's no stents. You're not just stretching tissue. You're rearranging the nasal pathway, okay? And that's why it stays open. You're microfracturing the bone, and then it stays that way. There's nothing there to push it back. It's not like setting an arm and you worry about pumping it. Once we open the sinus, you can irrigate it out. You can get all the drainage that was in there, which can be pretty impressive at times. These are actually pretty big cavities. And that's all we do. And then, like I said, the sinus is meant to clean itself. It's meant to be healthy, and that's what it will do. We're not scraping your sinus. We're not doing any further damage, okay? And so, just to prove it to you, you can see, of course, with some time it would clear up. So to prove it to you, we're going to show you a live video. Okay, I promise it's not gory, so nobody pass out. Suzanne, that includes you. All right, so this, before I play it, this is actually going to be of the same sinus you saw in the animation, just with a live demonstration, okay? So this has already been injected, so there's, a little bit numbing, and if you see little spots, here and here, that's just, from a needle poke to numb it up. And so the guide wire is already in place. You can't see it because it lights up on the outside cheek. And then the balloon is just, you saw something moving there. Now it's being inflated. And so you can see the actual outpouching of that area. And that area right there is called the Untitled process, which the name's not important. What's important is there's a little piece of bone you saw in the animation, then skin actually covering both sides of it. And so that's what we're trying to outfracture and leave a nice open hole. And you don't need to make it huge. It does not need to be, a foot wide. You just need a little bit to make it drain, so when it swells, it can still drain. Okay? And you saw with the inflation, it's not blood gushing out. There's nothing really scary. And really, to kind of help explain it better, since it's just me doing it, I've actually brought a patient of mine who very nicely agreed to give a quick explanation of his experience, kind of what he was feeling. He actually had this done in the office, so not under general anesthesia, just under local, and he can kind of take it from there. This is Hamilton Gardner. He's a very nice guy, so be nice to him.
I'm Hamilton Garner. I'm a lawyer here in Moultrie and in Thomasville. I met Dr. Gilbert back in October, November. My procedure was actually in November. I went through what Dr. Gilbert explained as the cycle for about 15 or 20 years. Once or twice a year, bad sinus infection, antibiotics, miserable, miss a couple of days of work, to the extent that I could almost predict them. I normally got a toothache on the top, both sides of my head. That meant I was getting a sinus infection. 2 or 3 days I'd be in the doctor's office. The toothache developed into chronic headaches. I'd been to 2 different allergists over the period of several years. I've been to several different family physicians. No relief. You take Sudafed, 2 or 3 days later, you finally get to feeling better. 3 months later, 6 months later, the exact same cycle all over again. Very miserable. Got to the point that I was frustrated, would be the best way to put it. I was constantly congested, constant stuffiness, and I took Sudafed or some other over-the-counter almost all the time. I snored very bad, and You know how miserable that is when you're married. Met Dr. Gilbert, talked to him. He explained that this new process. I had one of my best friends had the Fez procedure, and he was out of work for about 3 or 4 days. He was miserable. He had galls packed up in his head. It was awful. I met Dr. Gilbert, talked to him about his procedure. I went in on a Friday afternoon, about 4 or 5 o'clock. Had the procedure on Friday afternoon. Saturday morning, the next morning, I went duck hunting. I would recommend it highly. Dr. Gilbert's staff, some of his staff sitting in the back of the room, they're some of the most professional and courteous and friendly people you'll ever meet. Procedure was in the office. I would compare it to going to the dentist. Was it uncomfortable? Yes. Was it painful? No. The worst part really was getting the anesthesia, local anesthesia in your nose. Now, that was the end of November, I believe. I can breathe better. Actually could breathe better before I even left the office. Very little difficulty breathing anymore. Have not had a sinus infection or any sort of a flare-up. Improved drainage, no congestion, and my wife has even commented that I don't snore as bad. Now, I don't know that this is a snoring procedure, but if that's an added side effect benefit, then even better. The only immediate side effect I had was a little bit of bleeding, just nasal bleeding, and a procedure that I would highly recommend. Very minimally invasive, not painful, and again, a recovery time of less than 24 hours.
All right. Well, thank you. Give a round of applause. It takes a lot to come up and talk about your personal health, so I appreciate it. All right. So basically, we're just kind of go into one last thing. So in doing this for now over a year, since I've been here a year and a half now, started doing it relatively quickly once I came down here from Ohio, where we had started doing it up there as well. We've completed the minimally invasive sinus program, which has taken a bit of time and work. It's let me get this to go. In my office, which is just down the street, it's the Allergy Center, in conjunction with the hospital. It's a new distinction as of February. The program was completed by training both the hospital staff, office staff, kind of mastering techniques, proving safety, that kind of stuff. And then I've done over 100 surgeries already just last year alone with this. And so it's very, you can see how common this problem is for people to really get started off the bat and have so many people that need help. And then it's by completing this program through a clearance which monitors it to make sure you're completing all the steps. In my opinion, we're using all the techniques possible to treat the sinuses, which again, in my humble opinion, the more options you have, the better treatment you have. Just like if you're going to build something in your workshop, or you're going to build, bake a cake or whatever you like to do. If you have one instrument, if I have a hammer and nail, I'm going to build a terrible, treehouse for my kid. But if I have a bunch of instruments, I can actually do a pretty decent job. Just like if you have a bunch of utensils to cook with, you're going to do a better job. You can curtail things to what you're making and what you're doing, and every patient is different. It's not this is not everybody gets the same thing. We're really curtailing things to what your problems are and where your disease is. This is the only minimally invasive sinus program in our region. It's again, as of February, you'll probably see more of this as we kind of try to educate people in terms of what we're trying to do. And in summary, there's many options for chronic sinus sufferers. We've kind of been through the over-the-counter prescription, procedural things. So these newer techniques are minimally invasive, which is a big change from back in the day, where this isn't really the same thing you might have heard about, your parents have had, where they said they were black and blue for 3 weeks. That's probably the most, if I had a dime for every time I mentioned sinus surgery to a patient, and they said, I don't want to be black and blue, I don't want all that packing in my nose. I've heard about, Aunt May had that, and it was awful, and I would never do that. She would never do that again. This is not the same thing. Things have really progressed quickly over the decades, and it's not nearly as destructive. You do need to be evaluated by an ENT, somebody who knows what they're doing to the sinuses. Just because, like I said, it's not like you have a sinus problem and you get treatment A. Everything's curtailed to you. Sinus surgery is not a magic pill. We're not taking out your sinuses. It's not like having your tonsils out. You do have them still. because of that, where the goal of surgery is to make you feel better. You have less symptoms, less severe symptoms, less often basically. And that's the whole goal of surgery. Make you feel better, and when you do get an infection, you don't feel as bad. Everybody's going to get a sinus infection every now and then. My job is to make you more normal if you have this kind of problem. It's not, like as I said many times now, it's not one size fits all. Everything is different. What patient A has and patient B has might be two separate different surgeries, different outcomes, different goals of treatment. So it does really require a good workup to find out what truly is going on with you, to make sure we know for sure. And each sinus is evaluated independently. So it's not even to the patient, it's to each sinus. Which sinuses are infected? Is it one? Is it all 8? Do you have other problems contributing to this? There's many, many parts that go into this to really figure out a good game plan to make you feel better. And these newer techniques, they do limit your downtime, they limit your pain, and they get great results. So there's, again, a lot of new things that are exciting out there. You'll probably see a lot more of it, especially, as anything new develops in different pockets of the country, it starts catching on. You'll see it more nationally. And that's it. So hopefully you don't feel like my kids when I talk about work. They're cute, but they have a short attention span. Anyway, I'm happy to answer any questions. If you ever need to talk to me, we have just developed a website. There's my office address and phone number. Call me anytime. I also go to Cairo and Camilla to see at the specialty clinics to see patients if that's easier for you. But really, I happily answer any questions you may have. Yes, sir.
Maybe mixing apples and oranges, but if you have an allergy problem and it causes you to keep having these sinus infections, will this surgery help that, or do you have to go back and find out what you're allergic to?
Okay, so the question was, if you have allergy problems triggering sinus problems, do you need to go back and have the allergy testing, or will this procedure help you? The question is maybe. The answer is maybe. So yes, the procedure would help you because you're predisposed to sinus infections, but you still, sinus surgery does not treat allergies. You still have the sneezing, itchy, watery eyes. So if you do have that problem, then that more can be done, hopefully, to control that better. But you still have the narrow anatomy that's getting plugged, whether it's an allergy or virus. Yes. Yes, ma'am.
Is your surgery only for the maxillary?
Good question. No, ma'am. The question was, is the surgery only for the maxillary? The surgery itself, you can actually balloon 3 of the 4 sets of sinuses. They all have one hole that drains them that you can balloon open. The ethmoids, which are those little kind of eggshell caves stacked on top of each other, there's not one hole or crevice to balloon. But for a lot of people, if you can open that critical area to the forehead and to the actual cheek sinuses, then it improves most of the others as well. But yes, the balloon procedure can be done on 3 of the 4 sets.
It would not do on the frontals?
It would on the frontals. It would not on the ethmoids. Yeah, the ones between your eyes, it would not. You cannot balloon those physically. It's just not possible. Correct.
Where did you get your training?
Question was, where did I get my training? I came from Ohio, where I did all my training, both at Ohio State University, which actually I didn't know I wanted to be a doctor. I did chemical engineering. And then I went to med school, Ohio University, and got my med degree. Then went back to Columbus, Ohio for my my residency and training. So.
Does the sinuses have anything to do with the sense of smell?
Absolutely. The question was, do sinuses have anything to do with the sense of smell? Yes, they do. It doesn't mean every time you lose your smell that it's your sinuses, though. Sense of smell can just go from a virus. It can be from... There used to be a nasal spray that could cause it. That's not in the market anymore. But it could be from chronic inflammation in your nose. All of your smell receptors are in the top of your nose. If there's anything to block those, then you don't get the air up there and you don't have a good sense of smell. So a lot of people, once you fix the sinus problems, barring some abnormalities, then smell does usually get better. But not for everybody. I wouldn't say that's 100%, but yeah. I think somebody had a question.
Question. Do you see much loss of the sense of taste with what you see?
With the surgery or with the just symptoms?
With the problems.
Oh, so the question was, do you see a lot of loss of taste with this? Yeah, you do. Usually you see loss of taste once you get the loss of smell. A big part of that are people with nasal polyps, which are not cancerous growths in the nose, which can really plug up the sinuses. Those will definitely impede your sense of taste and smell. It's not very common to have loss of taste, but you do see it from time to time. Yes, sir.
What about hearing? Could that affect your hearing in any way?
Yes. The question was, can it affect your hearing in any way? It could affect your hearing. It's not a main cause of hearing problems. So if you get a lot of this drainage, it's designed to go into your nose, to the back of your nose, down your throat. Well, the back of the nose is also connected to your ears through a small tube called the eustachian tube. It's not always open. It's normally shut. When you yawn or you blow your nose and your ear pops, that's that tube popping open. So you can imagine all this drainage going past that tube. It will inflame it. It will make it clogged. And it could give you, fluid in the ears, a reactive fluid in the ears that does decrease your hearing. So that is possible. Yes, ma'am.
Will this surgery correct chronic sinusitis?
The question was, will surgery correct chronic sinusitis? The answer is yes. If you have chronic sinusitis, you will, in a sense, always be labeled a chronic sinus sufferer, but you always have it, but you will feel a lot better with less infections and less symptoms. So yes, it corrects it. No one could ever promise that you would never get a sinus infection again, because we're not removing the sinuses. But the whole goal is to correct the sinus disease. Correct. Any other questions? Up front here?
Out of curiosity, is it normal to have allergy problems every year that turns into sinus cold anytime the season changes?
So the question was, is it normal to have, said cold-like symptoms always turn to sinus symptoms, basically? No, we pretty much say it's abnormal if you're getting more than, an infection or two a year, depending on your symptoms, too. Some people just get a true infection a couple times a year, but they have symptoms in addition to that other times. So, no, a cold should not always go to a sinus infection. A cold is predisposing you to your chronic sinus disease usually. Without looking at your individual noses, it's hard to say. But no, you should not always get a sinus infection every time you get a cold or you have allergies. They should be separate problems, ideally. I think there's a question in the back, too.
If you don't have much problem with sinus infection, but you have a lot of drainage down your throat,
Mm-hmm.
Does this help with that, or what is the cause?
The question was, if you don't have necessarily a lot of sinus symptoms, but a lot of drainage down the back of your nose and throat, what is the cause of that, and will this help? That's a tough question to answer, only because it really depends on the cause, which would require, further, some testing to really tell you for sure if it is coming from your sinuses. Is it coming from just allergies or your nose? Is it not allergies, but you just have a kind of a chronic runny nose called vasomotor rhinitis? There's a bunch of different causes, so it could potentially be from chronic sinus disease. You don't have those acute symptoms. You have that low-lying brewing infection, but you really would not know until you get some sort of workup to see what's going on. An interesting note, I was going to mention this too. This is actually, the surgery is very good for kids, and of course not in the office, but I've done this on a number of children with chronic sinus disease, where before they would have to punch holes and flush out the sinuses. Now it's approved for kids 2 years and older, and they have specially designed pediatric ones. But we've done this on kids, and it's done remarkable for them too, for those kids that have just all the kind of chronic sinus problems that flare up the asthma. So it is very, very safe. If they approve it for kids, it's safe too. And again, you're not really preventing anything down the road. Any other questions? Yes, ma'am, over here.
Is it dangerous to use nose sprays like Astelin and Nasonex forever and ever?
The question was, is it dangerous to use nose sprays like Nasonex and Astelin, was the other one, forever and ever? Short answer is no. They're meant to be long-term chronic medications. They do have side effects. You can get nasal dryness, you can get bleeding, but there's not the steroids themselves that are sprays, they're not absorbed really into your blood to a detectable level. They don't interact with other medications. So they're safe, absolutely. They're meant to be, in fact, used every day for a long period of time. It is, just so everyone we're on the same page, it is dangerous to use Afrin long term. I've seen a lot of patients who are, quote, addicted to Afrin, which is a nasal decongestant spray you get over the counter. If you use it, it's okay, it works great, 3 to 4 days at the most. But that's one that can be dangerous long term. Does somebody else have a question over here? Yes, ma'am.
How do we get this process started? What do we need to do? Just make an appointment in office?
Yeah, to get it started, basically it requires a new patient visit so we can talk about your symptoms, what you have done, what you've been given so far, and kind of just start you on that path of, have you been, depending on your symptoms, of course, and looking in your nose, do you have polyps, do you not have polyps? Usually to diagnose chronic sinusitis, we need to get a CAT scan, which is a fancy x-ray, but there's no IVs, there's no contrast, it takes 5-10 minutes of your time. But it details the bony anatomy of the nose. It tells you which sinuses are giving you a problem. Of course, after some medications to kind of figure out, are you algae, bacteria, fungal, that kind of stuff. Yes, ma'am.
There are many saline solutions, nose sprays. Are they good or bad for you?
Okay, the question was, there are many nasal sprays and solutions. Are they good or bad? In general, the nasal salines are very good. The sprays that come in, they're more of for nasal dryness. They don't flush anything out. They're for symptomatic relief if you have a dry nose. If you're going to use a saltwater rinse for your sinuses, you want to use a neti pot or a squeeze bottle. You want something with a lot of volume because you really want to flood your nose with the salt water. You need to make sure you use distilled water or water that you boil and let cool to room temperature, especially if you're on a well. You don't want any bacteria or anything you're putting in your nose. But they're very, very good to use. I would not do straight water. The salt is required to not make your nose congested. But they're very good for you. It's kind of like brushing your teeth. You're just keeping things healthy. So, especially after surgery when they're open.
How long do you think it takes to develop a rebound stuffiness using the saline, like you get with some nose drops?
Question was, how long does it take to get the rebound stuffiness from nasal saline? From the saltwater rinses, you mean? Yeah. So it depends how you use them and what you're putting in them. Usually if you get them in a kit, they come with a predetermined amount of water you put in a bottle and a certain amount of salt, which gives you the proper concentration. If people start making their own, you have to be careful you don't put too much salt or not enough salt where now all of a sudden, because of the difference of concentrations between your nose and the water, you're really forcing fluid into your nose. If you do it wrong, it could be a matter of hours, and then you're congested again. So.